is Donna Gambino. I'm a physical therapist, a certified Pilates instructor, and author of Age Perfected Pilates. I'm here today to show you how to use the BodyBolster for support for common postural problems you see with your mature clientele. The first thing that we want to work with is our neck. And commonly when we start to age, we can get what we call a forward head, which is just a shifting of the head forward. Paulie's going to demonstrate the exercises for us today. So Paulie, if you would just lay down on the mat. You're going to lay on your mat with your knees bent and your feet nice and flat on the mat. And you can see when Paulie lays down that her chin is just a little bit higher than her forehead. And that's not an optimal position for exercise. So what we're going to do is take the BodyBolster fully inflated. And there's two different ways you can use this for support of the neck. You can put it underneath the base of the head. And you're going to start with the valve on your dominant side. And you can see now she's a little bit too high. So she's going to reach back, just release some of the air from the BodyBolster until she gets in that nice position where she feels she's level. Okay, so she has no support under her neck right now. Paulie's a strong girl. She does lots of exercise. So this might feel very comfortable for her. You might notice sometimes if you have a disc problem or any type of severe arthritis in your neck that you may feel like you need more support. So what you can do at that point is just take out the BodyBolster, re-inflate it again. Always start with full inflation. It just works best that way so that you can get the proper position. Tighten the valve and put it right under the small of your neck. So right in that curve. Now again, she's just a little bit too high, so we're going to want her to reach back again, let out some air. She's going to keep her chin nice and tucked. Good. And now she's fully supported, so she's going to get that extra support that she feels she needs. So if your upper back is a little bit more round too, this may be a better position for you, and it's comfortable. She can do all her leg exercises now without any problems. So the next thing, usually when you have that forward head position, you get the rounding in the upper back and the tightness in the pectoralis muscles as well. And so there's two exercises that you can do to help with stretching those using the bolster. She's going to come up. We're going to have her sit up. And what we're going to do is, again, inflate that BodyBolster, tighten the valve, and we're going to put it horizontally on the mat, right in the middle of her curve where that roundness is. Now, her head's not going to be supported unless we use another BodyBolster and put it underneath her head. We want to have a nice support so that her head is supported. Then she's trying to reverse this upper back curve. So she's got it a little high right now, and we're going to just lift her up a bit and move it down just a tad. There you go. So she's getting a nice arc right over the BodyBolster. And this is going to allow her thoracic spine to just relax and go into the other curve, which is a little bit better posture. Okay? So this is a nice stretch to do. Just laying there resting, inhaling and exhaling, 20 to 30 seconds, 2 or 3 times a day, couple repetitions at a time, and just let yourself rest there. The next position that you can be in for this is she's going to nod her chin, come right up, is moving it vertically into the back, and just right between the shoulder blades, she's going to lay right back down. Head is supported again. This time now we can stretch out more of the pectoralis muscle and let her arms just kind of hang out to the side. Palms can be up towards the ceiling. And as she breathes, she's going to let those pectoral muscles just stretch. So inhaling and filling those muscles with air, and then exhaling, just softening the muscles and letting those muscles just open and lengthen. This is a nice, gentle position. BodyBolster is nice and soft. It's not going to be hard on the spine or cause any irritation. Again, always check with your doctor too. If you have any osteoporosis or any severe postural problems, check with him to make sure that it's okay for you to do the exercises. And try them out. They're great exercises. Go get some BodyBolsters. Thanks a lot.